All right, guys. So let's talk briefly about how important Nola Pender's health promotion model is within the nursing practice. I'll touch on three evidence-based practices or evidence-based research studies that I found, which I thought were pretty interesting. Um, I've noticed that this is very, very highly recognized internationally, and I think that that's really cool. It's not just here in the States, which is where Nola Pender's from. She truly is recognized across the world for her nursing practice and her theory. So let's get to it. Here's the evidence. So here's a study that was done by a couple researchers in Iran, which demonstrated how important Pender's health promotion model was amongst women who were pregnant. The researchers had found that there was a huge discrepancy amongst nutritional status in pregnancy in women in Iran, and they thought that this was a way for them to try and increase the healthy food that they eat, how they followed the food pyramid, and made correct dietary choices. Amongst the 192 participants, there was a pre and post test done at between 6 and 10 weeks, and then again at 34 and 36 weeks. So pretty much amongst the whole span of the pregnancy. These women, it was noticed that amongst the experimental group, which was half of the 192, they did interventions for like seminars on healthy food choices, and they got a dietitian involved. And amongst these women at the 6 to 10 weeks, between the 6 and 10 weeks, and then again at the 34 and 36 weeks, their healthy choices had increased significantly. And as a result, their pregnancy outcomes were better. So I thought that was pretty cool how just by using the health promotion model within these pregnant women that they had better healthy dietary choices throughout their pregnancy. Another study that was done in Turkey was amongst these type 1 diabetic adolescents. We all know within the nursing practice and within nursing itself, these these children, the adolescents who have diabetes, they're one of the toughest group of kids to work with. They've been diagnosed with this chronic illness that they're going to have for the rest of their lives, and they just rebel. That's what you do as you're an adolescent. So this study took a group of 36 participants. I know it's a small study, but they did an 8-day intensive training course on education and how to properly choose healthy carbohydrates, how to keep good track of your blood sugar, and how to make good food choices. And they measured an A1C at 8 days post training, and then at the 3 month mark. So only after 3 months after. So it's a short study as well. But there was a decrease in the A1C. So majority of the kids after who were in the experimental group after the 3 month training, their A1C had decreased to below 7.5%, which is astronomical, and that's great for these kids who have type 1 diabetics. So by implementing this health promotion model amongst these children, it gave them the autonomy to try and make better healthy food choices and better health decisions on their chronic illness that they face. Another study was done I believe it was done in Iran as well, and it was an experiment conducted by these researchers, and they studied the effects of how Pender's health promotion model improved the nutritional behavior of these obese and overweight women. In Iran, obesity and overweight is the the percentage is very, very high, and because of the culture and because of the food choices, they're more at risk of being overweight and obese. Um, this quasi-experimental study had 108 participants. They did pre and post tests. They were divided then into two groups. The intervention group received intensive 3-day educational lectures and seminars. And then after that, over a period of time, it was measured how their food choices and how their attitudes towards healthy food behaviors were conducted, and that was what was done in the post test. And it was shown that there was a significant increase in healthy food choices, and they were more inclined to do exercise and more inclined to eat the healthy vegetables and fruits as opposed to the other groups who did not receive the intervention. So again, by giving these women the autonomy to create healthy food choices and kind of create a path for their own health care, it showed a difference in how they would choose to live their lives. So then how can we apply this to practice? So this can help us to engage the patients within their own care, give them the autonomy to make choices within their own healthcare decisions. We can use another big barrier to with we have found within the nursing practice is that interpretation methods are poor. So by using the proper interpretation for a patient who does not speak English when we're trying to discharge them or give them educational materials, that can greatly improve how they understand their healthcare and how they understand the plan of care for them going forward. Um, Also encouraging families as well as patients to attend wellness seminars and group educations has been proven to improve healthy outcomes within these chronic conditions. This day and age, especially in this area, I know that they offer tons of education seminars for diabetes, high blood pressure, high cholesterol, cardiac disease. There's just so many opportunities. Even if you don't have insurance, I know a lot of these not-for-profit organizations, they organize community outreach things for these diabetic populations because, as we know, in the immigrant population, there's a very high rate of diabetes and heart disease as well as hypertension. So in order to get these people under control and recognize this, if we give them the power to kind of make their own decisions and the autonomy to like go forward with their healthcare, we can greatly improve their outcomes. So I hope that this kind of helps summarize a little bit about what Nola Pender's health promotion model can do for us in practice as nurses, as well as how we can help these patients move forward. Here's a couple references, but if you have any questions, feel free to reach out to me. I'm Megan Harvey. My email is msturm1 at masonlive.gmu.edu. And if you have any questions, please feel free to reach out to me. I hope you guys enjoyed this brief lecture and maybe it helps to better understand why Nola Pender's health promotion model is so important to us within the nursing practice. Thank you guys.